The similarity in the maps of the force of infection between Kawasaki disease and pediatric infections suggests a common route of transmission shared by these diseases. The force of infection, or lambda, is defined as the probability at which an individual who is not immune to a pathogen is infected with the pathogen in 1 year. It is known that the lambda is approximated as in the following equation 1. Lambda is 1 divided by A, where A represents the mean age of patients. For example, if the mean age of patients for an infectious disease is 10 years, its force of infection, or lambda, would be 0.1. This implies that 10% of the non-immune children would thus be infected in a year. We compare the geographical distribution of the force of infection in Japan between Kawasaki disease and pediatric infectious diseases to predict the characteristics of the etiological agent of Kawasaki disease. The age-stratified annual number of Kawasaki disease and pediatric infectious disease cases from between 2000 and 2010 was obtained from each of Japan's 47 prefectures. From this data, the mean patient age, or A, was computed. The force of infection was estimated using the above equation 1, that is, lambda is 1 divided by A. We explore the socioeconomic and climatic factors which determine the distribution of force of infection by using spatial regression. This example effectively illustrates how we estimated the crude mean age of patients. The second column in this example indicates the midpoint age for each age class. For example, the midpoint age for the age class 2 years is 2.5. The third column represents the number of reported cases in each age class. The crude mean age of patients is estimated by summing the midpoint ages weighted by the number of cases. In this example, 0.25 is multiplied by 10. Plus 0.75 multiplied by 20, and so on and so on. This value is divided by the total number of cases. The final answer is 2.4 years, which is the crude mean age of patients. Mathematically, this crude mean age of patients is expressed as in this equation 2. However, this estimation can be interfered by the age structure of the prefecture. For example, in a prefecture where there is an unusually large number of very small children, the crude mean age of patients would be unfairly young. To adjust for this bias, we estimated the adjusted mean age of patients by using this equation 3. These histograms show the distribution of ages of patients. The mean age of patients who contracted Kawasaki disease is 2.4 years. This value is the smallest, only next to exanthema subitum. We explored the socioeconomic and climatic factors which determine the force of infection of each disease. To do so, we applied spatial regression analysis to the dataset from all 47 prefectures in Japan. We included main 4 climatic factors and 37 socioeconomic variables. Figure 2 shows the distribution of the force of infection in Japan for Kawasaki disease and 7 pediatric infectious diseases. Force of infection was represented as the inverse of the mean age of patients. Force of infection is colored from blue to red in an ascending order. Remarkably, the distribution of the force of infection is very similar between Kawasaki disease and pediatric viral infections. For example, hand, foot, mouth disease, apangina, and chickenpox. These distributions of the force of infection were positively correlated with total fertility rate. Total fertility rate is the expected number of children born to a woman. Therefore, the total fertility rate reflects the total number of children in one family. The age of the patients for Kawasaki disease was smaller than most of other pediatric infectious diseases, implying a strong force of infection. Kawasaki disease and pediatric viral infections shared a similar distribution of the force of infection. This distribution was determined by the total fertility rate, which reflects the number of siblings in a family. Sibling-to-sibling transmission may be an important route of propagation of Kawasaki disease and paediatric viral infections. We are grateful to the assistance by Yoshikazu Nakamura and Mayumi Yashiro of Jichi Medical University. Thank you.